like to share with you some of the things we've been doing in our benefits department over the last year or two that we're very excited about. In 2021, our team worked extensively with one of our key clients, as well as some local healthcare providers, and in conjunction with the team at Health Rosetta, an organization we're a part of that is part of a movement around the country, really, to reshape healthcare and how it's delivered, how quality healthcare is delivered, and how much we pay for it. It's called a community-owned health plan. And really what that is just an arrangement between an employer and some local healthcare providers, primarily healthcare hospital systems, that have a direct contract relationship, agreed upon rates for services when their employees engage with their local healthcare providers on what the costs will be. It's done with a couple of hospital systems in our geographic region, along with several other locally owned community healthcare providers. And the way the plan works is that the employer structures his benefit level to share some of the savings with his people through the form of lower deductibles. So if an employee engages one of the local healthcare providers that we have an arrangement with, their deductible is half of what the normal plan deductible is. So some people choose not to, and they can go to any hospital or doctor they want to, anywhere in the country, really. There is no network of doctors. You can go anywhere you want to. But if you go to a select few in our local community, then you experience a better benefit in the form of a lower deductible. We wrap the community-owned health plan with a reference-based pricing model and a provider that provides that service to our employers. So the employee on your health plan can go anywhere they want to in the country, literally, any hospital, any doctor. And they're either going to get, those claims get processed by a third-party administrator, either at an agreed-upon level with the local providers we have agreements with, or through a reference-based pricing model that we have in place. And now, through 7 or 8 months of data and processing a couple thousand claims, we are thrilled with the results that we're seeing. So people are accessing our local healthcare providers and receiving a better benefit to do so, and our employer is saving substantial amounts of money on their healthcare spend. One of the fears that we had was, how's this going to go when we are seeing dramatic now effects in level of benefit being improved and level of spend being decreased. And we couple this with some other areas, some other buckets, as we say, where your money goes, which is prescription drugs, using independent PBM contracts that have also carved significant savings out of the drug spend, and that benefit is allowed to be passed along to your people as well. So employees are getting the same drugs they were getting before. Now they're getting them without any copay, free of charge, and the employer's saving a substantial amount of money on their drug spend. The mission is to deliver quality health care at a much more affordable rate and change the curve on healthcare costs for an employer that has been unsustainable and will be if you stay on the same track. I'm Brad Forney, president of BCF Group.